This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how to tell if you broke your knee. I'll first start off by saying that if you really broke your knee badly, you'll know because you won't be able to walk on it and it will be a tremendous amount of pain. So there's three different areas of the knee you can break. You can break your thigh bone or your femur, or you can break your tibia bone. Usually the top of the tibia is called the tibial plateau, or you can break the kneecap. If you break the end of your femur, you'll have lots of pain. You're not going to be able to walk, and you'll have to pretty much get immediate treatment. If you break your tibia, that's called a tibial plateau fracture. They kind of range from not really super displaced or to really displaced. So usually most people that break their tibial plateau fracture, they know they're not able to walk on it and it hurts tremendously. Same sort of thing as the femur, where there's not, that something's seriously wrong, you can't walk and you'll have to get medical attention. Where x-rays of either of the two will usually show it. There is a caveat to tibial plateau fractures. Sometimes people will get these kind of bone contusions or bone bruising, but it's really more of a fracture than a bone bruise, but it's a really small part of the tibial plateau and it doesn't go across the whole thing. And in that case, they can have a lot of knee pain, and this is usually after some sort of trauma like a car accident, like let's say you bang your knee on the dash. You can have a lot of pain, and the x-rays will be normal, and it really hurts. In that case, you can only see these kind of really smaller tibial plateau fractures by MRI. And usually, most of the time, tibial plateau fractures usually always need surgery, but if you have one of these really small, non-displaced ones, then you usually can get away with just non-operative, with non-weight bearing on that knee. But by and large, if you broke your knee, you're going to know. And then there's the kneecap. Usually if you broke it bad, the kneecap will actually pull apart. And again, it'll be pretty obvious. You're not going to be able to straighten out your leg. And you'll actually feel a decap in the kneecap. Sometimes if it's broken a little bit less, the kneecap will just hurt really, really bad. And it might have not spread apart, in which case x-rays will tell you if that moved apart. But usually there'll be a lot of bruising and swelling anytime you break anything. So basically, to summarize, if you break your femur, you'll know. If you break your tibial plateau, you're going to know, except in some cases where you'll have to get an MRI to see. And if you break your kneecap, if it spreads apart, you'll know. But if it's just bruised or it's a small break that doesn't move apart, then you might not know unless you get x-rays. Never a bad idea to get your knee evaluated if you think you may have broke it. So I hope I was able to answer your questions about how to tell if you broke your knee. If there's any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond, but note that I can't give you medical advice about your specific situation. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.